So the treatment of facets. So let's start first by discussing what is a facet. The facet is the joint that occurs here in the spine, in the back end of the spine. You have the spinous process, the superior articular process, inferior articular process. So there's a little joint here that's there when you're flexing your spine. So flexing your spine backwards causes pressure on this area. Treatments include but are not limited to, we start with physical therapy and a home exercise program. Anti-inflammatories, interchanging heat and ice on the area. This joint here, again, between these two bones, there's a joint, and that causes that deep, dull, aching pain. You have deep, dull, aching pain and stiffness that shoots outward to the sides of your spine. And patients say that it limits their quality of life and activity. So what we could do is, if you don't improve from physical therapy and conservative therapies such as massage therapy, home exercise program, we're able to bring you in and do another treatment. What we do is we block a sensory nerves. These sensory nerves are supply the joint and occur from above this joint and below this joint. So imagine there's a joint in between these two bones. We block those sensory nerves. You come for 2 different visits. If you get at least 80% relief, we're able to then place a needle there, minimally invasive. You're numbed or you have oral sedation, very comfortable. We're able to place the needle there where the heat can be applied to that sensory nerve, and by applying heat, which you don't feel, you're numbed for that heating, we are able to deaden the sensory nerve, and you don't have pain to that joint. A lot of our patients do well. It's life-changing. We've had patients who have had pain for 10 to 20 years. They come and they have that procedure. We have also patients who have had fusions where they have hardware and this is all fused. So now the levels above have problems with the joints because they've lost their mobility, the flexion and the extension. So the joints end up having issues. We're able to do this procedure. They're able to avoid surgery. They become more functional, and they have a better quality of life. So here at Southern Pain and Spine Specialists, we'll work with you. We'll find your underlying condition, and we're here to fix you and make you feel better.